Okay, so I just got dispatched to a scene. The patient just called because he hurt his ankle. We're not sure any other information. But before I approach the scene, like I'm already in my ambulance and I'm approaching the scene, I'm gonna consider scene safety. I'm gonna make sure the scene is safe, which we don't quite know yet until I'm actually on the scene. We don't know the mechanism of injury and how the patient hurt himself. I only have one patient, and we don't know if we're gonna need extra EMS yet, and I'm probably gonna consider stabilization of C-spine considering it's some type of trauma, so yeah. So, hi sir, I'm an EMT, why'd you call EMS today?
Hello, I was hanging up Christmas lights and I fell off the ladder.
Oh, okay.
Yeah.
Oh, okay, gotcha. Okay, so at this point, wait, okay, hold on. All right, and where you fell off the ladder, and where's the pain coming from? What's hurting you?
My leg. I think I twisted or did something my leg.
Okay, sounds good. Okay, so my general impression of the patient was that he is responsive. He has a good Glasgow-Coma scale, score of 15, which will make him a patient, so far a low priority patient. And his mental status was obviously good, and his chief complaint was just having some twisting leg pain. So additionally, so far his airway is packing good. He doesn't need so far any type of breathing therapy, no oxygen is needed. So now I'm just gonna assess his circulation. All right, I'm just gonna assess your circulation, make sure everything's going good in your body. So his skin is pink, warm, and dry. His pulses are equal. There's no apparent bleeding, so no shock therapy is needed so far. And okay, so now I'm gonna go ahead and get my vitals on the patient. All right, so I'm just gonna take your vitals, blood pressure, got it all done. All right, so the vitals on the patient are of normal range. He's a older patient that maybe has vitals of 140 over 80 or 90. He has a pulse of 86. Don't worry, he's not too old. A pulse of 86 and respirations of about 18. So now I'm gonna get my history from the patient. All right, do you have any allergies, sir?
I'm allergic to peanuts.
You're allergic to peanuts, okay. And you didn't consume any type of peanuts or anything today?
No.
Okay. And are you taking any medications right now?
Let's see, I'm diabetic and I got high blood pressure.
Okay.
I take medicine for that.
All right, and did you take your medications?
Yeah, I take them every morning, yeah.
Okay, and you didn't lose consciousness or anything when you fell, before you fall?
Nope, I just fell, landed on my leg bad, and now you're here.
Okay, you must have just slipped then, right? It wasn't anything based on your diabetes?
Yeah, I think I just misjudged the step and fell off.
Okay. And so you have a history of diabetes and you ate, when's the last time you ate today?
I had lunch at around noon.
Okay, and what were you doing before you were going to hang up your lights?
Well, I just was getting, the boxes out of my garage and open them up and then taking them out and hanging them up around the house.
All right, so you weren't doing any type of excessive hard moving or anything that may cause you to be overly tired?
Well, just taking the boxes out of the shelves in my garage.
Okay, sounds good. So for my history taking, I got his vital signs and I got a sample history. And so now I'm gonna go ahead and do my physical exam. All right, so I'm gonna go ahead and do a physical exam on you to make sure you're okay and you didn't hurt anything else when you fell. All right, so I'm just checking the head, I'm checking behind the ears. There's no cerebral fluid coming from the mouth or nose. I'm checking the cheekbones, the eyes. They look like they're reactive to light. So now I'm gonna feel the C-spine also. All right, the C-spine feels fine. I'm just gonna go ahead and check all the way down the spine while I'm here. If you can lean forward just a little bit. All right, I'm kind of checking the buttocks area. I'm just checking it because I'm here. You can go ahead and lean back. So now I'm gonna check the neck. All right, there, the trachea looks like it's in line. There's no masses or anything, and there's no jugular distension. Okay, so now I'm just gonna go ahead and move down the chest. Is there any pain when I push like this?
No, I'm fine there, yeah.
Okay, so I'm just gonna go ahead and keep checking the chest. And And at this point, I'm gonna have my stethoscope and I'm gonna auscultate lung sounds. Wait forward for me. Okay, so the patient's lungs are clear, equal, and bilateral. And so now I'm gonna go ahead and check the abdomen. All right, sir, do you have any abdomen pain or anything like that before I check?
No, just my leg.
All right, sounds good. So I'm just gonna check your abdomen. I'm gonna move down. Any pain?
No.
Okay. So I don't feel any type of mass or anything in the abdomen, so patient looks like it's good. All right, so now I'm gonna check the pelvis. I'm gonna go ahead and put some pressure against your pelvis.
Oh,
and make sure.
okay.
Is there any pain when I do that?
No, that's okay.
Okay, so no pain there. The pelvis seems fine, and I'm not seeing any bleeding or anything. There's no pain there. So now I'm gonna go ahead and check his upper extremities before I check the lower extremities. Can you grip my hand, sir?
All right.
All right, and can you wiggle your fingers? And close your eyes. What finger am I touching?
My thumb
And what finger am I touching now?
and my pinky.
All right, so check the pulses. So the pulses are equal, like stated before. He has CSM and motor functions. All right, so now I'm just gonna go ahead and feel all the way down your arm. So first I'm visualizing the arm. I don't see any type of decap BTLS. The arm's not bleeding or anything like that, so we're good. I'm gonna just go ahead and feel the arm, okay? Feel the hands. Okay. Any pain or anything when I'm feeling all the
No.
arms?
No,
Okay.
hands are good.
All right, so now I'm gonna go ahead and move down the legs. I'm gonna start with his left leg, considering he hurt his right leg. All right, can you, so at this point, I'm gonna take off just this boot because he said he hurt his leg here. And so I'm gonna leave that boot on just in case his ankle injury will provide some stabilization. Okay, so can you wiggle your toes for me? All right, can you push towards my hand and have it away from my hand?
Yep.
All right, so I'm gonna check his pulses. So his pulses they're both equal. And what toe am I touching?
I think it's my big toe.
Okay, so, all right, so he has good CSM on this leg. I'm just gonna go ahead and feel down your leg if that's okay. Any pain in any place while I'm doing this?
No, that leg's fine.
This leg's fine? Okay,
Yeah.
perfect. I'm just feeling the feet now. Okay, so now I'm gonna switch over to this leg. I'm not gonna have him do any type of motor function here because this is his hurt injury. But I am gonna go ahead and see if he can just wiggle his toes for me. So where exactly do you think you hurt your leg, just before I go ahead and palpate it?
Oh, everything from like my knee down to my foot.
Okay, sounds
Yeah.
good. So I'm probably gonna want to go ahead and remove the boot, considering the pain is going all the way down. I want to make sure that he has some type of circulation going on. And so, yeah. So I'm feeling he does still have circulation here, but I'm gonna ask if he could wiggle his toes. Can you wiggle your toes for me?
Yeah, it hurts, but I can still move them.
Okay, so he has, and what toe am I touching right now?
Pinky.
Okay, so he knows what toes that I am touching. His CSM is still good on this leg. However, he says he's claiming that there's some type of numbness from here all the way. So I'm gonna go ahead and palpate your leg. I'm just gonna feel if there's anything that maybe you don't know of or anything. I'm gonna go ahead and feel all the way down. So the pain kind of starts here.
Yeah, right at my knee. It did.
Okay.
Yeah, that's where it
Sounds
hurts.
good. So is that
Yeah,
hurt?
right there. Oh, yeah, that's tender.
I'm just gonna feel all
Oh,
the way down.
that's some shooting pain up my leg.
All right. So
And my ankle hurts too.
okay. Sounds good. So this whole entire leg right here sounds like it's hurting. Like I said, I already felt down the spine and the buttocks area in the beginning of the assessment. So considering this leg is hurt right now, I'm probably gonna go ahead and splint the leg and joint completely immobilized from here down. And this patient is going to be, I'm gonna go ahead and put him at a low priority transport still, considering he's only having issues with this leg. He still has CSM in the leg. And so we're gonna go ahead and transport him, and I'll reassess him every 15 minutes.